Hello, Dr. Keith Smith with you on behalf of the Free Market Medical Association. The Surgery Center of Oklahoma was a proud sponsor of the Free Market Medical Association's annual conference last year, and we're hoping, Jay Kempton, Charles Sauer, and I are all hoping that many of you as individuals will join us this year in Oklahoma City, August 21st and 22nd at the Skirvin Hotel for this year's meeting. The details are on the website at marketmedicine.org. We're very excited about this year's meeting, expecting a very, very large attendance as interest in the ideas of the applicability of the market in healthcare are spreading all over the country, and the benefits of putting buyers and sellers together in the room at the same time are becoming obvious to more and more people. I would like to take a couple of minutes to discuss the idea that the market is not at work in healthcare, or the market can't work in healthcare. I would suggest the market is always at work. Sometimes when the government gets involved, the only results of the market's influence you see are consequences. The market is always at work. Human nature can never be changed. When individuals are left to their own devices to seek out mutually beneficial exchange, you see the beauty of the market. Now, whenever the government gets involved in exchange, you just see the power of the market, and it is invariably negative. When you see governments get involved in setting prices, then you see shortages when those prices are too low, and you see surpluses when those prices are too high, with, for instance, a medical procedure performed many times more than it should be because the government has decided the reimbursement for that should be set at some level above the market clearing price. It is a disaster for government to get involved because it unleashes just the dark power of the market, and all we see are the consequences. The market was at work even in the Soviet Union, and it was a black market, and that's the reason many people now know that many Russians survived. The only reason they survived was there was a black market for goods. The absence of a distortion of government in the market in healthcare is very obvious in plastic and LASIK surgery, where prices are not only low, they're dropping while quality simultaneously increases. This is the free market at work without the influence of the government. Are the people who promote insurance for all, are the people who promote non-freedom in healthcare, are they well-meaning and misguided? Are people who say freedom is not a good idea, the market should not be at work, are they really well-meaning and misguided? I believe some of them are. I believe some people actually believe that the free market is a force for evil and only for the rich, only because they truly misunderstand the beauty. All they see is how the power brokers use power, and that is not the market at all. Or are the people who say in healthcare the free market doesn't work, are they diabolical? Are the power brokers, the big corporate players, the ones that say healthcare cannot be married to the free market, we cannot have transparency in pricing, are most of the people saying this not well-meaning, not well-intended, but rather the people who have benefited the most from this lack of transparency in pricing and this lack of market power? I would suggest that there's a little of both, but a whole lot more of the latter than anyone is willing to admit or believe. I just wanted to share some of these thoughts with you and also give you a heads up about our meeting in August, and hope to see you all there. This is Dr. Keith Smith on behalf of the Surgery Center of Oklahoma and the Free Market Medical Association. We'll see you next time. Thanks for joining me.